In this episode, I answer a question from a massage therapist in Pennsylvania about why I never take on a client in acute pain who is trying to find relief as soon as possible. Welcome back to the Soft Tissue Treatment Revolution podcast, where we teach overworked massage therapists a new treatment method that cuts session times in half and eliminates the frustration of inconsistent results so they can avoid burnout and help more people get out of pain. Thanks for stopping by and checking out the show. All right, so this question came from a massage therapist named Charles from Pennsylvania who is in year 10 in practice where he focuses on injury and pain treatments. The question was, I have a pretty steady and busy practice, and most of my new clientele comes from referrals from other clients. I do love helping people who are in pain. One area I struggle with is trying so hard to accommodate someone who is in acute pain and wants to get in as soon as possible and is also a referral from an existing client. I have found that even when I bend over backwards to add them onto an already full schedule, when I explain to them that they need to do more follow up work, they just tell me they will call me back when it gets bad again. I'm glad I can help them, but my goal is to support them long term rather than just responding when things get really bad and assuming I can get them in right away. I saw a video where you said you never treat a client who has been in pain for less than 6 months. How do you say no to people who just started having pain without upsetting them? Just a quick reminder, I love doing these episodes. So if you have any questions you'd like me to answer, send them my way. And if I think I can help, I'll get an episode out to you. The information to submit your question is in the profile or wherever you're consuming this episode. So let's just start off with mindset. I tend not to be a huge mindset person, but I've been coaching and training massage therapists for going on like 7 years now. And a lot of it isn't like a discrepancy or lack of skills. It's more in the mindset and thinking a certain way. First is it's okay to say no politely. You don't owe people anything. A lot of times people think, oh, I have to do this. I have to be available for this client. I have to, you know, add more clients to my schedule. I have to burn myself out because I'm here to help them and I want to sacrifice everything. You don't owe people anything. At the end of the day, like the work we do is really, really important and it can help people, but we're not treating them for cancer. We're not treating them for a heart attack. So if they have to wait a little bit, it's going to be okay. Next idea is if you're for everyone, then you're for nobody. The thing that I see a lot is we, as providers, we want to help every single person that comes in, and we feel bad when we can't help them. But if you're trying to help everyone and you're not clear about who you help and how you can help, it's going to be confusing. It's going to be frustrating for you. Next is just being clear about whom you help. That sets you apart from everyone else out there and puts you in a specialty category or a specialist. I say at the end of the day, a specialist gets paid 10 times more than a generalist. Next is just the scarcity mindset, thinking this idea, well, if I say no to this client and I can't help them, like I'm going to be struggling. I'm going to be in the poorhouse. I'm going to get a bad reputation that I don't want to help people. There's plenty of people out there that are injured and in pain that need your help. A lot of times they just don't know that you exist. So there's plenty of people out there. You're going to be able to help. So why do I hate treating acute pain? First off, usually they're really desperate, they're short sighted, and they're looking for a miracle. Often, acute pain, when it first happens, can resolve in a short amount of time if it's just left alone. And in the past, when I've tried to treat during an acute flare up, it can cause some of the following problems. Number one is a lot of times there's this stuff called protective tension in the tissue because a lot of times when they're getting like that really horrible acute pain, it might be an injury to like the disc or the joint or something like that. So the body lays down a lot of inflammation, and then the muscles around there, they engage in this stuff called protective tension to take the pressure off of there. One good example I see this is when someone's having like a back spasm and their QLs start to fire, and they won't let go. So the idea with the therapist and the treatment is like, hey, we got to get these QLs to relax and take the pressure off of there. So it does temporarily feel better, but it actually exposes that problem a lot worse. Next is it's just too inflamed to do much of anything. That first 72 hours is usually the body, just let the body kind of do its thing. Let it kind of chill out a little bit because treating through that acute stuff is just going to make temporary reductions in pain, but it's going to expose that problem even more. They're going to have to deal with a bigger problem down the road. And lastly, these clients are usually one and done and they just wait again till it gets awful again. And then they expect you to get them in right away. So you've kind of like facilitated that behavior. So They're just like, yeah, I can call, what's his name again? I can call Charles and he's going to get me in right away because he's done it before. And then when you can't, then they start to get angry, they start to get mad, and then they think that the whole world revolves around them, and it makes things, a lot worse. So, how do I handle these issues in my own practice? First, I just start by qualifying them. I say this all the time. You got to be clear about who you're for, but more importantly, about who you don't treat. I start by qualifying by saying, hey, do you have a specific problem that I treat? For me, it's usually going to be neck, shoulder, maybe some arm pain, and then low back and sciatica. Other than that, I don't treat those type of issues. But the key thing that I want to see is that they've been in pain for at least 6 months. The reason I do that, because when people are in chronic pain, they're going to follow the process. They're going to see it all the way through. They've been through it before. They understand. It's also going to help me give them clear ideas about what I can do and how I can help, where they're not just looking for that like quick fix and then right back to it all over again. I still do show empathy for them. Like, it does suck when they're having an acute flare up. I don't just like completely ignore them and leave them on their own. I get on a call with them, I'll talk to them for like 5 or 10 minutes and I'll explain exactly what's going on with the acute pain. And then I'll tell them the best route is actually to let it settle down for a few days. Most people don't want to hear that. They'll call the next person. The chiropractor will get them in right away. The massage therapist. There's always someone out there that'll get them in right away that really only cares about getting their money, doesn't really care about long lasting results or helping them. And then I also just explain nicely to them that I'm a specialty clinic and I actually have a higher price point, but that's because I work with those in chronic pain. So it wouldn't be a good start to start with me anyway, because I'm more expensive. And I explain why I'm expensive, and it kind of sets you apart there as well. And then I do tell them, once things do settle down a bit, go see a provider that's not as advanced. And that might seem, you're like, oh, you're being a jerk. I'm not being a jerk. But there are people that want to do lower level, pain treatments and stuff like that, which is totally cool. And hopefully they can help resolve the problem. Even better if you do have someone that you can send them to, or maybe they do more traditional work. You tend to be more of like the specialist and the expert. And then I tell them, hey, go there, try this out. It's going to be a little more affordable, a little more budget friendly. And if that doesn't help, then reach back out to me and then you can come back in and we'll get this problem fully resolved. But I hope that you actually don't need me. But I have to reserve my practice for people that are in chronic pain, that have been dealing with this problem for a significant amount of time, haven't got any real results or any long lasting pain relief. So I appreciate you reaching out. And I'm sorry you're going through this, but I'm not the person to help you in this part. More than likely, just let it chill out and it's going to be okay. If it doesn't get better, see someone else. And if they can't help, then come see me. So it's a really important concept and a really good question. I understand wanting to have availability, but if you're that person that's like, burning it at both ends, maybe you had like 6 or 7 that day and you squeeze them on and you want to help them. And then you go to tell them like, hey, we can prevent this from like happening again. They're like, yeah, I'll just call you again. It frustrates you and you don't even want to work with these people. So I hope this way I laid it out can be a little more helpful for you to avoid these problems in the future. That's all I got in the episode. As I close out every episode, go out there and be great this week. The world needs access to your amazing treatment so they can stay the hell away from the traditional medical model of pain pills, injections, and surgeries that only make things worse and definitely ruins people's lives. I appreciate you listening to the show, and I'll catch you on the next one. Bye.